Hello everyone, my name is Reese Stowwagon, and this is NURS447 voiceover PowerPoint project over workplace violence in healthcare, understanding the issue and seeking solutions. What is workplace violence? Workplace violence, also called WPV, is recognized hazard in the healthcare industry. Workplace violence is any act or threat of physical violence, harassment, intimidation, and other threatening, disruptive behavior that occurs at the work site. It can affect and involve workers, clients, customers, and visitors. Workplace violence ranges from threats of verbal abuse, physical assault, and even homicide. And that is OSHA's definition. We will dive further into the different forms of workplace violence throughout this PowerPoint. The reason why this is such an important and poignant topic is because healthcare workers experiencing workplace violence may experience suicidal ideation, PTSD, depression, anxiety, burnout, and they continue to feel anger and fear and other emotions. The national scope of workplace violence. Despite only making up 10% of the country's workforce, healthcare violence accounts for 48% of the non-fatal injuries. It's estimated that 1 in 5 healthcare workers will experience some form of workplace violence, and that workplace violence in healthcare is 4 times greater than in other industries. One of the leading problems with workplace violence in healthcare is that much goes unreported, and I can speak to this firsthand. I've been yelled at, kicked, screamed, and I've never done anything about it. I think many healthcare workers just accept it as it's part of the job, when in reality it should not be part of the job. Types of workplace violence in healthcare. There are 4 types of violence in healthcare. You have criminal intent, customer, client, worker on worker, and personal relationship. Those are pretty self-explanatory. Criminal intent could be a mass shooting event. Customer client could be a patient on a staff member. Worker on worker would be 2 coworkers, and then personal relationships would be a partner or friend being violent at the hospital. And then those can be shown in different ways as well. You have physical violence or assault, which would be hitting, kicking, punching, spitting, verbal abuse, shouting, threats, racial slurs, sexual slurs, derogatory comments. Psychological violence would be like intimidation, bullying, emotional abuse. It could be cyberbullying too, sexual harassment, unwanted sexual advance remarks. And then the perpetrators be anyone from patients, visitors, coworkers, supervisors. It's any unwanted attack on your mind, body, or spirit. While all forms of workplace violence should not exist in healthcare, there have been some noted contributing factors that might increase the likelihood of someone becoming violent. There are patient factors like altered mental status, dementia, delirium, substance abuse, psychiatric conditions, pain, frustration, fear. Visitor factors, which would be stress, long wait times, dissatisfaction with services available. Family dynamics can play a big function into that. Poor diagnoses, environmental factors, poor lighting, lack of exit routes, overcrowding, and then organizational structures, which could be inadequate staffing, lack of clear policies, insufficient training with de-escalation techniques, economic restraints on individuals without health insurance or other factors that contribute to a costly hospital stay. Not only does healthcare violence affect the staff members affected by the violence, but it can also impact the patients, because nurses and healthcare workers who experience violence are more likely to experience burnout. And when they are experiencing burnout, they might call in more often, which leads to absenteeism, leading to them potentially leaving the field, leading to understaffed, which can increase healthcare costs, which makes healthcare access more difficult, decreasing quality of care the patient is receiving. And it's kind of a vicious cycle where if we don't do anything, the violence continues, and both the patients and the healthcare providers are suffering. A healthcare system that has repeated healthcare violence can also just create poor morale and unit cohesion, which can hamper mood of the patients and the nurses, and just really creates a unhealthy environment for everyone involved. What can we do to help prevent healthcare violence? The first thing is engineering control. So these are going to be techniques and devices used to physically put a barrier between you and the patient. So that might be improved lighting, security exits, physical barriers like plexiglass shields, panic alarms for nurses, security videos, security. Next would be workplace controls, and that would be systematic identification and communication of high-risk visitors or patients if they've been violent in the past on a different encounter. Emphasis on de-escalation training and managing agitated patients, and then you can have it like a rapid response team, but a behavioral health rapid response team. I know at my hospital, I think it's code gray. And then staff training on the said de-escalation techniques, and then staff training on the behavioral health rapid response team. Policy and reporting mechanisms. Comprehensive workplace violence prevention program would be a multidisciplinary systematic approach. You need to create a zero tolerance policy explicitly stating that violence is unacceptable and will result in consequences. You need strong management leadership, visible commitment, allocation of resources, and champion safety initiatives. Employee participation involves frontline staff, risk assessment tools, and a solution-oriented mind. Robust reporting system, easy to use, that are non-punitive for reporting all incidents, including verbal abuse. I know at my hospital we use RL solutions. You can make an RL, you can make it anonymous, you can attach your name to it, and then adherence to standards. The hospital needs to comply with the standard of care, usually by the Joint Commission. Support for the victims and a culture change. Post-incident support, immediately debriefing of the critical incidents and stress management, what exactly led to the violence, access to counselors and psychological support, trauma-informed care for the affected individuals, incident review and analytics. Through the review of every incident, it can help identify root causes that are contributing factors, implementing lessons learned for continued quality improvement, fostering new environment while reporting and encouraging staff to feel safe and heard, promoting mutual respect and accountability for all levels, recognizing that safe environment is a shared responsibility. Workplace violence is a serious and prevalent threat impacting healthcare professionals, patient safety, and organizational stability. Addressing these complex issues requires a multifaceted, multidisciplinary approach, proactive prevention, robust policies, effective reporting, and unwavering support from staff. It's not merely an occupational hazard, it's a critical barrier to quality care and a healthy working environment. Prioritizing the safety of healthcare professionals is not just an ethical concern, it is a fundamental of delivery of compassionate, high-quality healthcare and the future resilience of our healthcare system. Here is a list of all the references I used to gather information for this topic. Thank you all for listening, and have a good day.